Hello, so I'm now going to show you how to do the ANTT procedure for your OSCE exam. What this is a small dressing change. In your exam you will have a simple surgical dressing to change. As with your other stations for the skills, the examiner will tell you you've already met the patient, introduce yourself and ID'd them. So no need to do that. So I would start with just explaining to your patient what you're going to do. As with the other stations, before you go there, decontaminate your hands with the gel. So palm to palm, back of my hands, fingernails, thumbs, centre of the palms and wrists. And again, as with my other stations, I would check my environment is safe before I approach my patient. So go over to your patient. So, hello Anne, how are you?
I'm fine, thank you.
Okay, I'm just going to do your dressing change. Is that alright? The doctors have taken it off to have a look at it.
Yes, that's okay.
Okay, I'll just get some things and I'll be back in a minute. Do you need anything in the meantime?
No, thank you.
No. Okay, so now once you've explained the procedure to your patient, go and start assembling your items. So first you'll need your dressing trolley. So my dressing trolley has been cleaned with soap and water in the last 24 hours, so I'm happy to use it. If you've touched your patient, I haven't in this situation, but if you have, you then need to decontaminate your hands again. Okay. Now next thing you need to do is clean your trolley, as you know, with the 70% alcohol wipes. So taking one wipe, cleaning the top edge of your trolley, and then cleaning the top shelf in a zigzag manner, from the farthest point to the nearest. Okay. So then dispose of the wipe in the orange clinical waste. Now do the legs of the trolley using a separate wipe. Rotating your trolley, making sure you don't touch the same area twice. And then again taking a third wipe and cleaning the lower shelf. So same as the top, start with the sides. Now start at the very back and coming forward in a zigzag manner. No need to clean these bottom legs. As I just said, this trolley's been washed with soap and water in the last 24 hours. So then hand gel in your hand, again demonstrating the different stages of hand hygiene. And now you can move on to assembling your items. So what we will need is a dressing pack, which looks like this. This is, so looking at the pack, we need to check the sterility of it and the expiry date. So what you do is you say, I've got my dressing pack, it's clean, intact, safe to use, and expires 2023. Okay, placing that on the bottom shelf of your trolley. And the same, I've got a dressing, so I've got for this patient a soft pore surgical dressing, which is clean, intact, expires 2022. I've got some sterile gloves. I've selected small gloves because I've got small hands. And again, it's clean, intact, expires 2021. We've got some saline to clean the wound, which again, clean, intact, expires 2024, and that's not leaking. And we've also got a 2% alcohol wipe, which is clean, intact, expires 2022. So with this, again, you don't have to learn the percentage of the wipe, the 2% alcohol wipe it says on it, so just use that as a little prompt. Okay, going back to your patient, would also take an apron. And some hand gel. Which I'm also going to take to my patient's bedside. So when you go back to your patient and verbalise, you would close the curtains, you would ensure there's no cleaning going on in the bay, and you would turn any fans off. Okay. Okay, so what you would do in the exam and on the ward obviously is if you have a sink available, you would wash your hands before you did this procedure. As we know, it's a sterile procedure, we need to wash our hands. So in the exam, if your station has a sink available, I would advise you do that. If not, I would just tell your examiner. So examiner, on the ward prior to doing this procedure, I would go and wash my hands, but there's no sink available presently, so I'm just going to gel my hands. Making sure the bar of your trolley is next to your patient's bedside. Now we're going to decontaminate our hands again and start with our procedure. So putting on your disposable apron. Okay, then I'm almost ready to do your dressing, so I'll just get my things ready, alright? Opening your sterile wound pack. As you know, this is sterile, so we shouldn't allow the outer packaging to touch the top surface of our trolley, so just open it and let it fall onto your trolley. And these are the wound packs we have in the UK, so all of the hospitals are quite similar. Okay, decontaminate your hands again before you open your pack. And when you open your pack, open it using the very corners and touching the underside of the paper only, obviously to avoid contamination. So now I've opened my pack, I'm going to, no need for me to gel my hands again. Now I'm going to clean the saline. So what you need to do for your exam is clean the neck of your saline with your alcohol wipe for 30 seconds and let it dry for 30 seconds. So you need to tell your examiner, I'm cleaning this for 30 seconds and I'm going to let it dry for 30 seconds. And then start counting, 1, 2, 3, 4, and your examiner will tell you 30 seconds is up. Now, if you leave it to dry, either stand it upright on your trolley or leave it over the side like so. Decontaminate your hands again because you've just been cleaning. And open up your other articles. So here I've got my surgical dressing. And my sterile gloves. Importantly, before you pop on your sterile gloves or touch your sterile field, gel your hands again, demonstrating the 7 steps of hand hygiene. Picking up this orange bag from the corner, and putting your hand inside, you can now use this as a sterile glove to lay out your items. I would recommend that you open up your sterile gloves now to make it easier for you to put them on later. If your patient still had the dressing on, we would remove it now using our bag as a sterile glove, but normally they give you a scenario where it's already been removed. For example, the doctor's come and had a look at it. So now if you invert your orange bag and then place it on the rail next to your patient, so we can use it now as a waste bag. Open up your saline. Again, as you know, we need to pour this from some height to avoid touching the inside of our bowl here. Again, gel in your hands. And now we will proceed with putting on our sterile gloves. So carefully put on your sterile gloves. making sure if we touch the outsides of this paper, like these pieces here, that they don't touch our sterile field. Dispose of it, picking it up in the middle here, so we're not touching the area that's unsterile. And I'll just pop that on the bottom of my trolley now. Okay then, so I'm ready to do your dressing now, is that okay?
Yes, thank you.
Okay, so placing your drape over your patient. For now we'll just assume there's a wound on the patient's chest. So what you need to do, if you haven't done this already, is make some comments about the patient's wound. So I can see your wound is healing well, there's no signs of infection, no redness or swelling, so I'm quite happy with that. Okay, so now starting our procedure, assuming this is my dirty hand and this is my clean hand. So always use your dominant hand as the dirty hand. In my instance, I'm right-handed. So picking up your gauze with your clean hand, soaking it in your saline, and transferring it to your dirty hand by dropping it. Okay, I'm just going to give your wound a little clean, be a bit cold. So cleaning from the outside to the inside in one swipe, and then taking another piece of gauze. Clean it a bit more, again transferring it. Okay. And once you've finished cleaning it, obviously dry it off with a bit of gauze. You can see I transferred that in the same way. Okay. Now once you've done, obviously put on your clean dressing. Be careful when you pick this up, so use your clean hand to pick it up. You will need your dirty hand to assist you. But make sure the dirty hand does not touch the inner part, which will be going on our patient's wound. So just be very careful with how we open it. Okay. So I'm all done with your dressing now. Are you all right?
Yes, thank you.
Do you need anything while I'm here?
No.
Okay. So I'll just leave you with the bell and just give me a ring if you need anything. Okay, so like with your other patients, other stations, give your patient a bit of reassurance afterwards and give them the bell. Now dispose of all your items. So just fold up your sterile field. Pop it in your orange waste bag. Remove your apron first. Roll it up and remove your glove so it's in a ball. Now dispose all of your items in the yellow waste bin. Decontaminate your hands, and now just tell your examiner that you would clean your trolley and complete your wound chart. So I'm all done with my dressing station now, so what I would do on the ward is I would clean my trolley and I would do my documentation. And that's it for your ANTT.